So I'd like to do a presentation on my case study, which was about minocycline-induced lupus. And I kind of decided to present it to you in a story format, because that's a little bit more exciting. First, I want to introduce the protagonist and the antagonist. The protagonist is a 15-year-old boy that I'm just going to call Paul. And unfortunately, the antagonist is on his face, and it is pimples. And its evil sidekick, I decided to make this drug called minocycline. So, like I said, Paul is a 15-year-old active male who played competitively basketball in high school. And up until this year, he hadn't really had any remarkable medical events. He lived at home with his mom. His dad was kind of out of the picture. And there was one thing that was mentionable just because it opened him up to physical therapy at a younger age. He was diagnosed with Osgood-Schlatter syndrome. And so I decided to name the PT, in this case, who's going to be our hero later on, as Stan. So that's Stan healing his Osgood-Schlatter syndrome. And like I said, there was no real events in the past, and up until this year, when things kind of took a turn for the bad, Paul had been trying, like creams and ointments and topical treatments for acne, but that hadn't worked. So he decided to kind of kick it up a notch and go to his primary care physician, who decided to prescribe him with oral minocycline. So what that is it's basically a derivative of tetracycline, which is also an antibiotic. So he began taking 100 milligrams of that a day, which was what his doctor had advised, and woke up about a week later, 2 weeks later or so, and woke up with 103-degree fever, swollen lips, which you can see there are bright red, and just not feeling so hot, but didn't really attribute it to the minocycline necessarily. His mom was also pretty alarmed with this, so what they decided to do was go back to his primary care physician, and he did, a standard exam and didn't make any note that this was to blame minocycline for. What he diagnosed him with was actually sinusitis. And so with that, he said, stop taking the minocycline for now, and I'm going to put you on another evil-looking drug, which was called telithromycin. This was also an antibiotic, but was more targeted towards his sinusitis. So he took that, as his doctor prescribed, and it seemed to clear up his swollen eyes and lips that he was experiencing, but he started getting a lot of pain 3 days later and noticed a truncal rash, which is what you're seeing now. So he went yet again back to the doctor, and yet again was prescribed another evil medicine that was meant to do good, but it was a steroid pack called methylprednisolone, and so he was still discontinuing everything else and only on these steroids. And this actually made him feel a little bit better. It had reduced all the swelling in his eyes and lips and got rid of the rash and everything, so he was relieved about that. The only thing that was left was he had swollen elbow joints. So this is Paul relieved. A few days after beginning the steroid pack, however, Paul began experiencing pain in both of his calves and in his right shoulder and hip. This was so excruciating, actually, that he couldn't walk without support, so it was a big deal for him. There's his deltoids in pain also. See the red? That means pain. And I think the worst thing for him was not only could he not play basketball anymore with this much pain, but that right hip pain was so bad that he couldn't even walk on it anymore. After this happened, he only waited 1 day before he decided, okay, I'm not going back to my primary care doctor. I'm going to go to the ever-faithful physical therapist that helped me when I was younger. So here is angelic Stan, who is here to save the day and fix all of Paul's problems. So he walks into the clinic, and right away Stan can see that he's not able to walk without support. And so they do a little subjective interview, and Stan finds out from Paul that he's been taking 2 extra-strength Tylenol tablets every 4 hours, just for the pain that he's been having, and that he has taken 2 of these tablets just 2 hours prior to their session together. So one thing became quickly evident to Stan: whatever was affecting Paul was a pretty severe thing. He had a fever despite the Tylenol, his heart rate was elevated, and just all around not feeling good. So he started doing then the typical PT assessment of Paul and found that he had severe range of motion limitations, actively and passively, mainly in his right shoulder and hip, which he couldn't even adequately measure because the pain was so bad. He tried to get a gait assessment, and so got Paul up and walking, and again noticed that he really couldn't bear weight on that right hip, and so he couldn't walk without support, just because the pain was so awful. And so the next thing that kind of popped into his head after that general assessment was there are a lot of red flags that kind of were pointing him to refer instead of treat. First off, the fact that Paul had a temperature of 99.4, which really isn't that high, but that was there even though he had taken Tylenol. Also, the fact that his pain was constant, severe, and spread across multiple joints. There was no mechanism of injury, and the fact that everything had happened with such a sudden onset was the 4th red flag. So with that, the next thing that Stan wanted to do was actually call Paul's primary care physician and kind of go over everything that he had found, the severe pain, the lack of mechanical pattern and everything. And together, they decided that it was necessary to do a referral. So next thing Paul knew, he was being referred to a tertiary pediatric hospital and was to be seen by a pediatric rheumatologist, who is this lady you're seeing here. So he stayed there for 7 days, and then his blood work finally had come back, and there were a lot of things found that pointed towards hypersensitivity to minocycline, which is what he was finally diagnosed with. Mainly it was these things called ANAs that were present in Paul's blood, which stands for positive anti-nuclear antibodies. So for that, he was just simply prescribed naproxen to help with the pain. Next thing we know, he's 1 month out and being reassessed by the PT. He still had 3+ out of 5 strength for his shoulders and only 4 out of 5 strength for all other joints. And he was still 11 kilograms under the weight that he was prior to taking minocycline. So that was only one of many bad things. By month 2, however, he had finally been getting back a little bit of strength in his shoulders. And actually, in all other joints, he had finally reached a 5 out of 5. There's his happy deltoid. And what this meant for him was that he could finally shoot a basketball again. But he still didn't have enough skill to, start rejoining the team, and still had decreased endurance and decreased gait abilities, and also had not gained back any of the weight. By month 3, all of his muscles were back to 5 out of 5 strength, finally. So this meant that he was improved enough to play basketball and get down the basic skills that he had before, but he still needed frequent rest breaks because of that endurance limitation. By month 4, he had maintained the 5 out of 5 strength and had finally upped his endurance, upped his coordination and ball skills. And fast forwarding a little bit is month 10, which is where finally everything had fully recovered and he had gained back the weight that he wanted. So the moral of the story is, don't take antibiotics for acne. I'm just kidding. The moral of the story is kind of this idea of pharmacovigilance within physical therapy. And what that means to me is a PT maintaining the ability to distinguish musculoskeletal presentations from drug-induced ones. So pharmacovigilance. And this is just one example of specifically how minocycline can present as a musculoskeletal problem. So just to highlight some of the things that you might want to keep in mind if you have a teenage patient or adult patient with acne who might have taken minocycline, there is the presence of two polys, polyarthralgia and polyarthritis. Along with the alga theme, we have myalgia going along with it. A lot of studies also found the presence of lethargy and fatigue and malaise in all the studies that they have done. Weight loss was present in most participants, and in some of the studies they even found that calf pain was also an indication that minocycline was involved. So I hope you got something from this, and just wanted to say thanks.